Welcome again, beautiful people. Let's talk about various ways you can get urinary tract infection without being sexually active. Holding your urine, tight-fitting clothing, and uncontrolled diabetes can also cause this infection. A urinary tract infection can occur when bacteria enters the urethra, that's the tube you urinate through, and travel to the bladder or the kidneys. But sex is a significant risk factor for urinary tract infection in people who are sexually active. Having sex causes germs from the anus to travel forward, where they can potentially get pushed up the urethra. And the best thing you can do is to prevent this keeping the area clean with mild soap and water, and peeing, of course, after sex. Certain types of birth controls, like diaphragm, which is a form of birth control, can increase your risk of urinary tract infection. This device compresses the urethra and can potentially interfere with the complete emptying of the bladder after sex. Then we have spermicide. They are also a form of birth control, can increase the probability of a person getting urinary tract infection. If you are dehydrated, you are not taking enough water. Researchers investigated the effect of increasing water intake for residents across 4 homes, and they find that those that are not taking enough water, they are prone to having that's urinary tract infection. Then another point is gastrointestinal issues. Being constipated can make it tough to completely empty your bladder, which increases the risk that that will make bacteria to multiply. 6, passing gas like aerosolizes bacteria, which can spread to upper genitalia. Holding in your urine is one of the factors. You may not be able to make it to the bathroom the second the urge strikes. Regularly holding in your urine increases your risk of urinary tract infection. And of course, kidney stones or hard deposit that can form in your urinary tract are some of the most common risk factors, because they can block your urinary tract, making it hard to get all of your urine out, which lets bacteria thrive and multiply in your system. Pubic hair, that's your pubic hair around your private area, can act as a ladder for bacteria to go from the anus, if it is not properly shaped, to vagina. Bacteria can also cause pubic hair to be transferred to the urethra. If you are fond of wearing tight-fitting clothing, tight pants, tight underwears, especially those made from spandex or nylon, can trap moisture against your body and allow bacteria to thrive and multiply. Of course, tongue underwear, the tongue underwear can also be problematic, since it acts as a structure for bacteria to get to the vagina. Instead, why don't you opt for breathable cotton underwear and loose clothing? Number 8, uncontrolled diabetes. Keeping your blood sugar within the target range is the best way to prevent urinary tract infection. If you have diabetes, blood flow to the bladder naps can be diminished if it is not properly controlled. A lack of blow can make it harder to contract the bladder properly and fully empty it. So, therefore, any bacteria will continue to multiply and thrive if you cannot expel your urine. Then, of course, we have wet bathing suit or sweaty workout clothes. If you keep them long, or you are wiping the wrong way, regularly wiping from back to front, especially pushes bacteria from the anus into the vagina. So you have to learn how to wipe appropriately, which has to be from front to the back. After using the restroom, which may lower your chances of having urinary tract infection. See you in the next video. Mwah.